Pleasant good afternoon to everyone, members of the media. Thank you so much for taking the time to be here this afternoon. We have just concluded a seminar on medical tourism, which included industry partners from the health sector, the tourism and hospitality sectors, and various other agencies that have a role to play in helping the BVI to prepare to enter into this growing market, this growing industry. And we've been very pleased to have the support of the Medical Tourism Association. And with me is Mr. Jonathan Edelheit, who is the Chief Executive Officer of the Medical Tourism Association, and he can tell you a bit more about that organization. And they have assisted us in covering a range of topics this morning that gives all the industry stakeholders a firm understanding of what is required for the BVI to be successful in our bid to enter into this market as an emerging destination of choice. So I thank you for being here, and I will ask Jonathan to say a few words of introduction.
Thank you. I'm the CEO of the Medical Tourism Association. We're the global nonprofit trade association for the industry and work with governments and hospitals in over 100 different countries. Medical tourism is a $60 billion and growing industry. As the world becomes globalized, patients are traveling to other countries to receive higher quality of care or more affordable care, or to gain access to care they may not have in their home country, or it may be long waiting periods in their home country. I think it was exciting for us to participate here in the BVI with the invitation of the Permanent Secretary and People's Hospital. Medical tourism has a really great opportunity here at the BVI. It is already a tourist destination. With the building of the new hospital, that will add a piece of quality that is the perfect mix to attract patients from the Caribbean, patients from the United States, could be Canada, UK, or Europe. Medical tourism would have a really positive impact on the local population because when patients travel for medical care, they usually come for 2 to 3 weeks, and they bring their spouses or loved ones and family. So they spend a tremendous amount of money in the local economy, and many studies have found that medical tourists spend more in the local economy than a normal tourist does.
Thank you. Just by way of background, for the background to what Jonathan just shared. As you know, here in the BVI, we've been investing very heavily in strengthening the healthcare sector, ensuring that our facilities are up to international standards, working on quality improvement initiatives, and we are confident that with the opening of the new People's Hospital, the BVI will be well positioned to be able to attract the best doctors and services to the BVI, and be able to have these services available so that more of our people are able to access high-end, high-quality care on island. Because our primary objective, of course, is strengthening the local healthcare industry or the sector, so that BVI landers are able, persons living in the BVI, are able to access care on island as far as possible. And in doing so, we've been exploring partnerships with a number of international organizations. You know of our affiliation with HEMA Health, and we've had approaches from a number of other specialist organizations because, as Jonathan mentioned, as the medical tourism industry grows, the Caribbean is a perfect option for persons from the U.S. mainland, Canada, and jurisdictions that would normally come to the Caribbean for tourism visits anyway. The opportunity to be able to access high quality medical care in the destinations in the Caribbean has been very attractive, and for that reason we have had approaches from hospitals and other persons in the industry seeing the BVI as a potential partner in this industry. So we've been examining today, and going forward we'll be looking more closely in terms of market analysis to consider carefully what are the specific services that we want to venture into and promote the BVI as a place to come for these services. And with the help of the MTA and other partners, we feel that we're in a strong position to enter that market. So with that, with those few words of introduction, I will invite any questions.
Crystal Kay from the BVA Beacon newspaper. You had a good variety of people just in for the previous session. I wonder if you could share with us some of the concerns from those folks, particularly in the tourism sector.
I think some of the concerns that would be from the tourism sector, and I think we addressed that in our presentation, is what is going to be the role of the hospitality and the tourism sector here, and that is incorporating them into the entire process. So it's not just a process that involves the public sector or the hospital. It's when a patient comes for medical tourism, they're going to be staying at the local hotel. They're going to be taking it could be a taxi or a car service. They'll be engaging in tourism activities that the doctor recommends, or that the doctor says they can do. They'll be going to local restaurants. They'll be doing shopping, and it's training all the different sectors. From it could be the taxi drivers who are going to be picking them up from the airport and dropping them off, to tour operators providing tour options to the hotels, so that they know how to specifically offer those services to medical tourists, because they'll clearly have a different need than normal tourists. They might have, recovering from a procedure, or have bandages, or have limited mobility. So I think the main concern from some of the people in the audience was that they're not left out of the process, and I think that the permanent secretary would agree with me that it's the training of all the sectors would be a key part of that strategy, so that you have a positive experience for every patient who comes.
Good day, Gordon French, BVI Platinum. I just want to know, based on discussions you had today, how far away is the BVI from becoming a player in the medical tourism industry?
I would say that the BVI has for many years been participating in medical tourism. We know that, for example, in the area of cosmetic surgery, the Bougainvillea Clinic has been a leader for some time, and there is some experience in the local industry in dealing with medical tourists. I think what we are seeking to do now is expand the scope and the range of services that are available and make our presence felt, market ourselves as such. And we spoke today about the need for having persons trained and certified as medical tourism professionals, and the timeline that was given in relation to that was in the region of 6 to 9 months. What will happen after today's discussion is the formation of a working group that will pull together a medical tourism strategy based on the research that we will conduct, that would point us in the direction as to how we and when we should enter the market. So I wouldn't want to speak out of turn and try to pin a date on it in the absence of that data. But it's not an overnight process. We've from the onset, we've tried to involve all the stakeholders. So everybody's involved from the initial stages of discussion as to should we enter have a larger presence in the industry, in what direction should we take it, and how should it evolve. So it is a process that will take some time as we roll out, but we're well on our way to achieving that.
Sean Rose, JTV News. Are you at liberty to indicate at this time your immediate target market, given that you will be conducting research and market analysis going forward to determine exactly where you focus your marketing initiatives?
I think our traditional markets would certainly be a place to start. There are certain procedures that are not immediately available to persons in the Caribbean region. Some people have a difficulty traveling to Puerto Rico or the United States because of their immigration restrictions. And if we can have certain procedures being available here, certainly in the sub-region, we can see the potential for attracting patients from neighboring jurisdictions. The US, we had a great presentation on the Affordable Care Act that was just implemented, and implications that that would have on U.S. Medical travelers, and they're seeking, destinations, and organizations as well are seeking destinations that they can refer their patients to. So certainly the U.S. market would be one, but we don't want to limit ourselves, to those. But we would have to, as you say, based on the data, determine, where to start and how to roll it out. I don't know if Jonathan wanted to add anything to that.
I think creating the working group is the perfect first step, because I think you really have to look at identifying what the product is going forward, especially with the new hospital being built. What are the specialties that you're really going to be able to brand yourself as in a global destination, global world, and create a real strategy around what markets you're going to go after. So I think it's important to create a really long-term sustainable plan and not just, jump into it and say, medical tourism, everyone's doing orthopedics or plastic surgery, we want to do that too. So I think the working group is that first step, and then incorporating, the public and private sector to have those discussions and to formulate a real long-term strategy, which would really result in a lot more long-term success for the BVI.
Malika McPherson, the Island Sun newspaper. Mrs. Davies, you indicated that there have been some partnership interest expressed already, and you also alluded to the fact that the Bougainville Clinic has already been doing this. Is it correct to assume that the Bougainville Clinic is one of these indicated proposed partners, and who are the others?
Thank you for that question. The reference I made earlier was the interest shown by international organizations, international partners in working with the territory to either provide specialist services, doctors who would come to the BVI and perform certain procedures, or hospitals that would partner with us and set up certain specialist services in the BVI. The BVI as a medical tourism destination requires the participation, the cooperation of all stakeholders. So the Bougainville Clinic participated in today's seminar, and we see, that there is certainly an advantage for us to work together with the private sector locally to ensure that we all adhere to very high standards, that we market and promote our services collaboratively, because as was mentioned, when a medical tourist comes to the destination, whether that experience is positive or negative is going to reflect on all of us. They're not going to differentiate between whether the provider was public or private. So we very much intend to work closely with the private institutions in making sure that our services are provided at a very high standard.
Good afternoon, Ms. Davies and Jonathan. Kathy Richards, Virgin Islands News Online. Has there been any studies or surveys done to determine the extent of the readiness of the BVI to expand in this area?
That is exactly the next step that I mentioned earlier. Now that we've had the sensitization, I think the Minister of Health mentioned in the House of Assembly late last year that we had attended the Medical Tourism Congress in November it was, and based on the information that we've been able to gather so far, we sense that the opportunity is there for the BVI to benefit greatly from entering into this industry. But the next step following today's sensitization is to pull the working group together to actually conduct the research and develop the strategy so that we would have a very clear understanding as to what do we mean when we say the BVI is a medical tourism destination. We do not intend to try to be all things to all people. We can't offer every service here, but if we decide that we will offer these 2 or 3 services, we do want to be sure that we can be the best at it and that we can attract the persons to the BVI for those services. So that is the next step in the process.
From a cursor view, what is the most strongest area in the BVI in terms of medical, from what you would have seen generally?
I'm not sure if I understand. In terms of the potential for us to enter into in terms of the interest that has been shown so far, we've had persons interested in offering neurology and orthopedic services as well as oncology. But again, we're very much in the early stages of discussions on those services.
Mrs. Davies, my memory is a bit sketchy on this fact, so please help me. In the past, a Plastic Surgery Association met annually in the territory for a conference, but unfortunately, the conference hasn't been held here for at least, I think, 3 years. Is it going to continue soon? Or?
My understanding is that the Plastic Surgeons Conference is scheduled to be convened in the BVI next week.
Just a question as it relates to perception. Now we know the local healthcare system takes some licks sometimes, and I want to know, how do you intend to get over that hump? In other words, you're going outside to bring persons here, but how do you assure persons here locally that if you could bring persons, then they should be staying here as opposed to going to other jurisdictions?
That's a very good question, and this is why I say that medical tourism is part of our overall health reform strategy. And as you know, there's been a lot happening in relation to strengthening the health sector of the Virgin Islands. And we would not pursue medical tourism at the expense of the local patients. I think medical tourism provides an opportunity for us to strengthen the sector, because once a patient enters one of our facilities, we want them to have the same, level of care and concern expressed for their comfort, for their outcomes, whether they're a local patient or international patient. Medical tourism provides us the opportunity to strengthen the sector to the benefit of all our patients, all our clients. We don't have a very large population, and I believe for certain specialties, volume makes a great difference as to whether or not it's a viable option for them to operate from your facility. So being able to marry both objectives, the economic objective of having more travelers come to the Virgin Islands for medical care, and of course our own objective of strengthening the range and the quality of services offered to the local population, I think it's a perfect marriage. And we've been pursuing, as we've talked about before, accreditation of our health services, and the move to the new hospital presents us a great opportunity. So it's not just a physical relocation of services, it's an opportunity to do things very differently, to ensure that whatever we put in place is guided in terms of our procedures and practices, will be guided by international standards of best practice. And already we've seen the benefits of having that collaboration with HEMA Health in assisting us to achieve those high standards that could be translated throughout the entire health system.
On that note, Permanent Secretary, are you satisfied that you are seeing visible evidence of that transition in terms of improving the quality?
Absolutely. I wish I could recite to you the list of letters and feedback that we've gotten from persons, who have had, an excellent level of care at our facilities. Obviously, when something does go wrong, and things go wrong in every facility, but we try to learn from these experiences and strengthen our health system. And I must commend the management and the staff of the People's Hospital and the Health Authority for really taking on the challenge of addressing some of the challenges that we've faced in the past and improving the quality of care.
And are you satisfied that, given the venture into medical tourism, or to expand medical tourism services, is reliant on the completion and the opening of the new People's Hospital, are you satisfied that that hospital will be ready anytime this year? And are you looking forward to maybe before the first half of the year or the second half of the year?
Well, I can let you know a secret that the transition to the new hospital has already begun. In fact, some of the services are some of the offices are in the process of relocation as we speak. The minister did indicate that he would wish to formally open the facility shortly. I guess the date will be announced at the appropriate time. But the transition is, and as you know, we've put out a tender for a transition management firm, and a final selection should be made this month. and, well, by next month, since Standing Finance Committee is in session now. But we expect Cabinet to make a final selection based on the outcome of the tender process in the coming weeks. And certainly once that transition management firm is on board with us, we will have a much clearer timeline in terms of when the completion of the transition process will be.
A question as it relates to, since you talk about marrying, are you going to adopt the idea of medical schools? Where does that fit into the whole idea of medical tourism?
Medical schools and medical tourism, is there marriage there?
In some destinations, I know, like for example, in the Cayman Islands, they have a huge project going on with a Indian healthcare provider that's building a hospital first, and then eventually medical school and universities and nursing schools. But I think that's tied more towards developing a healthcare city. Typically, where medical tourism is tied into medical schools, where you have an established medical school that may want to start training some of their students on understanding what medical tourism is, best practices in medical tourism, the types of procedures, so that when they go into practice, they potentially can treat medical tourists. And it also could be doing continuing medical education to local physicians on the patient process, pre-care, post-care, the continuum of care with medical tourism. But that's really kind of the involvement that we've seen so far in medical tourism with medical universities.
It brings me to a question about where is the ministry in terms of medical schools? Are we pursuing it or not?
Yes, I believe the minister would have mentioned before that it is one of those areas that the government would wish to see come on board. We have developed a brief that would inform legislation that would allow us to license higher education facilities, including medical schools. That legislation is in the drafting process right now. So once we receive that back, it will go through the process that would ultimately lead to it being introduced in the House of Assembly. And in tandem with that, we are preparing a request for expression of interest, so that persons interested in establishing a medical nursing school in the Virgin Islands would have a procedure to follow in formally bringing their proposals forward to the government.
Jonathan, just to hear your professional take on the BVI's readiness from a resource, facilities, and location standpoint. If you can elucidate a bit on why you think the BVI is in a strong position given its location.
I think the Caribbean is a very strong hub for healthcare. I think one of the things that I addressed in my presentation is that one of the challenges for medical tourism is having a destination that's attractive for patients to travel to. Patients are only going to go to destinations for which they feel is safe, and the majority of them bring companions with them. I think it's 90-95% of patients bring companions with them. So BVI already has that. They have an international reputation for tourism and for safety, and so the next step is just the healthcare and the quality, and the fact that the new hospital is opening, that it's moving to accreditation. When it has that in place, it's going to be able to be competitive on a global scale. And then I think that it's very easy to look at what target markets would be the best for the BVI to go after. Which destinations do you currently get most of your tourists from, and kind of targeting that destination. And right now in the Caribbean, I think it's also very important from a long-term perspective of being competitive and staying competitive with the rest of the market, because there is other investment going on in the Caribbean, and then you have some islands like in Bermuda and the Caymans where they're building facilities that they want to attract people from this region. So I think it's important from a competitive standpoint, the BVI getting very active in this space to, one, keep local patients staying here because of the investment in the healthcare infrastructure, new specialties being brought in, but by starting to get people from other Caribbean islands and other countries to come here, it's going to have a significant impact and boost the local economy.
Just to follow up on what you just said about competition in the industry, correct me if I'm wrong, but isn't Latin American countries, aren't they the ones that are currently leading in this area? And how easy then would it be for the BVI as a newcomer in the sector to actually surpass these current trendsetters?
It's if we're looking at regionally, the competition regionally, I would say would really be like United States, Latin America, the Caribbean, in that sector. So there is competition from those other countries, but patients travel for different reasons. Some patients travel because of the destination, and it could be they're bringing their spouse, and where's their spouse gonna do tourism activities or relax. Some of them travel because of cultural reasons or language reasons, or they're comfortable with that destination. So I think, the industry is growing and more patients are traveling. So as more patients travel, there's more opportunity for countries like the BVI to get involved. And the BVI just needs to establish its brand in the medical sector. This is a long-term project. It's not something where, the hospital's going to open and they're going to say tomorrow, we're taking medical tourists, and 10,000 medical tourists are going to, fly in that next week. But I think because the BVI already has an established brand and an established network of travel agents and others who, are doing business here and sending consumers here, it's just transitioning it to the next point. And it can happen fast if the BVI creates the right strategy and executes it properly to the right markets. In 1 to 2 years, they could become a leader in the Caribbean, and they could pull patients away from Latin America, because what we've seen over the past couple of years is there was a lot of medical tourism from, let's say, North America to Asia. And then the Latin American countries got heavily involved in medical tourism and creating a brand, and they were able to pull from a lot of the patient flow going to Asia, which now goes to Latin America. So there's that opportunity for BVI to come in and say, hey, we're closer, we've got high quality healthcare, we're a great destination and safe, perfect destination to recover in, and they could start pulling from business going to Latin America, but also trying to attract new business.
We said that the working group is the next step. So, did I understand it correctly? So we've named a working group, and if so, who's on it? I guess is the question.
What we've done is identify the key partners, the key partner agencies. Following today's sensitization, they're in a better position to understand what's required of us to take this to the next level. So what we'll be doing now is inviting those agencies to name their representatives on the working group, and we'll take the process forward from there.
So wait, so very so who are they?
Well, we have, of course, the Ministry of Health and BVI Health Services Authority. We've had the Premier's Office, Her Majesty's Customs, the Immigration Department, the Ministry of Finance. We've had the Social Security Board, the BVI Tourist Board, of course, and the BVI Ports Authority. And then we had representation from the private sector, the BVI Chamber of Commerce and Hotel Association, the taxi fraternity representatives, and I mentioned earlier the Bougainvillea Clinic as a private partner. And those are the key players at this stage.
Jonathan, a question to you. We know the number of other jurisdiction cosmetic surgeries are the obvious choice, but when you look at the market currently, what is trending in the market?
I would say, cosmetic surgery obviously has always been around and will continue to be around, as you said. But we're seeing a lot of growth in other procedures, orthopedics, knee replacements, hip replacements, joints, spine and back surgery. That's a really growing sector. Cancer treatment, is extremely growing. Stem cell therapy is growing very fast. But I would say orthopedics is one of the biggest growth areas that people are traveling from. Also bariatric procedures. As we face kind of, a critical mass of obesity around the world, more people are getting weight loss surgery. And we're seeing more governments and insurance companies starting to cover those procedures, where in the past they might not have. And I think that's also a great opportunity, for the BVI.
there are no other questions, we'd like to thank you for coming out to this press briefing today. Thank you, PS and Jonathan, for sharing with the media, sensitizing them to medical tourism. And thank you guys for coming out, and have a good afternoon.